Welcome to the Surgical Safety Checklist Mastery Guide, presented by Nagesh Sir for ND Nursing Coaching and Medical Surgical Nursing. Let's begin with the first question. Which of the following is the primary purpose of the WHO Surgical Safety Checklist? The answer is B, to reduce surgical errors and complications. The checklist is designed to improve team communication and adherence to safety protocols. Next question. When is the sign-in phase of the surgical safety checklist typically conducted? The correct answer is B. The sign-in phase occurs before the induction of anesthesia to confirm identity, consent, and safety markers while the patient is still conscious. Moving on, when should the timeout phase be conducted? The answer is B. The timeout is performed immediately before skin incision with the entire surgical team to confirm patient, site, and procedure. Here is the next question. Which phase occurs before the patient leaves the operating room? The answer is C, sign out. This final check verifies equipment, counts, and specimen labeling before any team member leaves the operating room. Who should be present during the timeout? The correct answer is C, the entire surgical team. This includes surgeons, anesthesiologists, and nursing staff, ensuring comprehensive communication and safety. What is the recommended timing for antibiotic prophylaxis relative to incision? The answer is B. Antibiotic prophylaxis is most effective when administered within 60 minutes before the incision to ensure therapeutic levels in tissues. Which of the following is not a standard component of the WHO Surgical Safety Checklist? The answer is B. Checking blood sugar for all patients is not a mandatory component of the standard WHO Surgical Safety Checklist. Let's review this question. Which phase includes the confirmation of site marking? The correct answer is A, sign in. Surgical site marking is confirmed by the patient and team during this phase, before anesthesia induction. Next question. What is the primary role of the nurse in the checklist? The answer is B. The nursing staff often acts as the coordinator of the surgical safety checklist, ensuring all items are addressed at each phase. What blood loss volume necessitates specific planning and IV access in the checklist? The correct answer is B, greater than 500 milliliters. This requires special planning, including confirmed IV access and blood availability. Sterility confirmation is verified in which phase? The answer is B, timeout. The surgical team confirms the sterility of equipment and that all instruments are available during this phase. Which action is confirmed during sign-out? The correct answer is B. Specimen labeling is a crucial element confirmed during the sign-out phase before the patient leaves the operating room. Which piece of equipment is mandatory to check during sign-in? The answer is A. The pulse oximeter must be on the patient and functioning before induction of anesthesia in the sign-in phase. What must be displayed during the timeout? The answer is B. Essential imaging should be displayed during the timeout phase to ensure the team agrees on the surgical site and plan. Which airway assessment is verified in sign-in? The answer is B. The anesthesia professional confirms the airway and risk of aspiration during the sign-in phase. Now let's look at another important safety question. Which items must be counted before the patient leaves the OR? The correct answer is A. Gauze, instruments, and needles must be counted before the patient leaves the operating room to prevent retained foreign objects. Next question. What information is confirmed during sign-in to prevent wrong patient errors? The answer is D. All of the above. Patient identity, surgical site, and procedure type are all confirmed during sign-in to ensure patient safety. What should the surgeon discuss during timeout? The correct answer is A. The surgeon discusses critical or non-routine steps, estimated blood loss, and anticipated problems during timeout. Equipment issues are addressed in which phase? The answer is C, sign out. Equipment issues and concerns are often addressed and documented after the procedure during the sign out phase. Which action is not part of the sign out phase? The answer is C. Introducing team members is done during sign in, not sign out. What is the focus of the debriefing step in the checklist framework? The correct answer is A. Debriefing focuses on learning and improvement, reviewing the case, and addressing any potential issues for future surgeries. Which allergy is checked during sign-in? The answer is B. Drug/medication allergies are checked during the sign-in phase to prevent adverse reactions before administering anesthesia or antibiotics.